Hi, my name is Dr. Clayton Chan, and I'm the founder and director of Occlusion Connections in Las Vegas, Nevada, United States. For the very first time, I'll be visiting Moscow on September 28th and 29th to be able to share something I'm very passionate about relating to G and M occlusion. It's a new term, but G stands for gnathology, the things that we learned in dental school, as well as the neuromuscular principles, new concepts that blend both the gnathology and the neuromuscular principles together in an objective, measured way. Today's practitioners must distinguish his or her practice by becoming an expert in dental occlusion. Oftentimes, we're not sure really what to do about it. We heard about it, we know it exists, but we're not sure how to deal with it. That's what I want to share with you for the 2 days while I'm in Moscow. Without new knowledge to change old habits, clinical failures will continue. It is essential for every dentist and team member to become an expert in recognizing the signs and symptoms of pathological occlusion and understand the parameters of healthy occlusion. When one evaluates a patient, we may begin to see worn dentition, missing teeth, failing broken restorations, tooth mobility, periodontal disease, as well as gum loss, bone loss, things that affect the health of the patient, the supporting structures of the somatognathic system, of the teeth, muscles, and joints. But when we're not able to relate these unseen forces that contribute to these occlusal challenges, it affects the whole body and postural system. Poor mandibular posture affects not only the temporomandibular joints, but also the teeth, the head, the neck, and the shoulder. That affects the well-being of your patient. Our dentistry, whether it be restorative, orthodontic orthopedics, or stabilization phase 1 splint therapy, is at risk if we don't understand the underlying issues. When to maintain vertical dimension of occlusion, when to adjust, when to grind appropriately, when not to, related to deep bite, excessive bites, open bites, cervical neck dysfunction issues are all key. How to deal with the airway issues, orofacial pain pathologies, will all be discussed in these 2-day programs. Key G&M principles of occlusion are necessary in today's practice for every practitioner to understand how to deal with both cosmetic, restorative, the orthodontic, orthopedic issues, as well as TMJ pain management to get our patients stable. Diagnostic awareness is absolutely key during any examination. On day 2, I'll be presenting to you clinical solutions, how to present and how to aid the dentist and team member in understanding how to convey and recognize these problems and implement the concepts in an everyday practice. 10 foundational keys to occlusion will be presented in order to reach maximal dental improvement to get your cases stabilized. When to grind the teeth and when not to grind the teeth, how to establish a physiologic jaw relationship before restoring a case using computerized memory scanning when we take a bite, how electromyography, electrosonography, as well as involuntary low-frequency TENS is key to establishing a proper jaw relationship. The difference between splints versus stabilizing orthotics to orthopedically align the cranial mandibular in 6 dimensions is key to understanding how to manage these cases before final therapy. I hope to see you soon at this Moscow meeting on September 28th and 29th. It will be a great time of 2 days of passion and a great time of sharing. See you soon and see you there.